today we have Jordan, who is a first year medical student at St George's. Hello.
Hello.
Thank you so much for spending some time today to come and talk about your journey to medicine.
Yeah, thank you for having me.
Yeah, perfect. So can you just tell us about what you've done before starting medicine?
Okay, so for the last few years, just before medicine, I was doing a biochemistry degree, and that was actually at Bristol. So I did my undergraduate. It's a bit of a long name. My program was called Biochemistry with Medical Biochemistry.
Okay.
And the reason it was called that was that as part of the kind of syllabus, as it were, you did touch on things like pharmacology and cancer along the years of the course. So that's what I did, and then I went straight from my undergrad to here to medicine at St George's. It's been quite chaotic because that's been finishing my undergraduate degree during the pandemic and starting this degree in the pandemic. So that's been very strange, actually. But prior to that, it's just kind of a normal story, really. We did my GCSEs, my A levels. I took a year out actually after my A levels. I had worked for a year and just did some bits and bobs, and then started up at Bristol in 2016. Yeah, 4 years later now, we're just starting this medicine degree.
Perfect, thank you. Okay, so had medicine been something you'd thought about like originally from school, or was it an idea that started to come together during your degree?
So it's a strange one, I guess, because when I was at school, I really enjoyed biology. That was kind of my main subject. I enjoyed biology and chemistry were the ones that I always thought were interesting, you know, when you're doing GCSE. And then at A levels, I did think about medicine, but I don't know what it would have been. Maybe an aspect of being lazy, but the idea that you had to, you know, get work experience and you had to, you know, there was one girl in the above who was taking this exam that you'd hear about, and you're like, oh, that's a lot of work. Can I be bothered? And then that was a strange one, actually. So I at that point I probably would have said no, although I guess it was in the back of my mind. But then definitely during my undergraduate degree, I mentioned, you know, about this medical aspect of it. That was where it started to spur in my mind. Oh, you know, this might be a really interesting career to go into. And I had to go and, you know, look into how do you even apply for it as a graduate? Is it different? You know, the difference to the programs, the funding. How does that all work? And actually, during my second year, I started to do some work experience. So I thought, well, you know, if I'm going to go down this route, I should find out if I like this kind of aspect. You know, is it really for me? So I actually, during the middle of my degree, on Wednesday afternoons when you have kind of sports off, I did some volunteering in the local hospital.
Nice,
so that was in the Bristol Royal Infirmary, which is just by the university. And then actually in the summer, to go along with that, because I really enjoyed that, in the summer I also did some caring experience. And then that kind of knew that when I was going to my last year of uni that this is something I wanted to apply for. So that it was kind of that point in my degree that I realized, you know, I think I actually want to try and get into medicine and become a doctor in the long run.
Yeah, absolutely. Because I think the academics is the side that perhaps can, you know, invite people to medicine. You know, it's really interesting, but actually it's the caring side as well. Experiencing that is so important. Because there is as much of that in medicine, I suppose. So you can't really be interested in one without the other.
I remember actually that was quite an eye-opening experience. Was when I did the volunteering at the hospital. So I was called a patient befriender, and that job role you would go into a geriatric ward, and in that particular hospital, the geriatric ward was mainly filled with dementia patients. And having done bits of dementia in some of the modules at university, particularly by the neuroscience department, I thought, you know, I'm quite, you know, I thought I knew a lot about it. But actually, when you meet a patient, you realize that the science is almost irrelevant at that point in time. And actually, the challenges that you get with somebody that has dementia, you know, whether it be physically, their mobility, their emotions, you know, all sorts of things, that really kind of sets in stone. Actually, you know, this medicine isn't just a science. You know, it really is something more than that. And that was one of the kind of key points which made me realize, you know, this isn't just going to be science plus people, which is what you're kind of told at A levels. I think at school you're told you think medicine in a very different way, unless you have family members or you've been on experience. And so that was really kind of eye-opening experience actually with that.
And I think, you know, getting that level of experience is actually, it's quite challenging to do, especially as a school leaver, because one, you know, your age is a limit, I suppose, in getting those sorts of jobs. And shadowing is great, but I think I've talked about before about how you usually get shown the really exciting parts, you know, the cool surgeries and things, and actually just spending time with a patient shows you so much about the important parts of the role.
And I think actually as well, when you look at a kind of when you're at school, actually, the age being under 18, that in itself actually stops doing a lot of things. But like you said, I think it's, it depends on the kind of experience you get. So when you look at a lot of universities, one of the things they'll say is that they don't just want you to have been in a GP shadowing for a couple of days, or because there's more to medicine than just kind of more the administrative side of things, and that kind of primary care is so different to the other sides of care as well. And actually, I remember at school, so a lot of my friends and those in the above that were considering medicine, it's quite difficult in Swindon to get work experience because we're part of the same deanery as Bristol. And actually, so as a result of that, you have a lot of doctors and nurses and physicians, a lot of other healthcare professionals that are training in the kind of those facilities. So actually, it's very difficult to get work experience. So I know that when people talk about a lot of barriers to medicine, that sadly is one of them. Is to get the work experience in the first place is actually probably just as competitive as then actually applying for the courses themselves.
Yeah, and I think it depends what course you're applying to, but the difference between undergraduate courses, from the ones I looked at, they don't expect as much experience because I suppose they acknowledge those barriers, but by the time you get to a graduate entry course, you've had that extra time, I suppose. You're older, so they do expect more from you in terms of experience.
And actually, that's something that's very much reflected in I'd say, both trying to get to the interview and also at the interview stage. So when we come on to that, it's actually the questions you're asked and the way they're asked, they're a lot more specific, and they expect you to be able to answer it in a much more kind of succinct way, which is always interesting. And again, it's something that takes a while to prepare for, and then trying to gauge what you need to be both aware for the answers, but also for yourself. What should you know really, and how you should be aware of these things, because there might be challenges later on in the career.
Yeah, absolutely. So starting to think about that application process, like how did where did you start? You were still doing your undergraduate. I'm sure you were really busy. Where did you start?
Yeah, so that was quite crazy actually. So this was during the second year when we were doing a lot more kind of I guess medicine related kind of subjects. And when I kind of got the ball rolling, as it were, I knew that I had to look online and see where can you even do a graduate course. What is a graduate course? Because and also what do you have to take in order to get into it. So that I think so when I did that, actually one thing I realized is that you actually need to really prepare. If you're planning on going straight after your degree, you have to sadly prepare quite early, because you have to be in the year before to then transition. So for me, the first thing I remember doing was the General Medical Council. Actually, they have a massive document with all the courses in the country. So they mention the 4-year courses, the 5-year courses, and also the 6-year courses. So excluding the ones in London, the 6-year courses normally refer to those foundation year, and sometimes you can be applicable for those. And then the 5 and the 4-year course, they were quite difficult to look into actually, because every university is so specific on their criteria. So that for me was quite a challenge, because I had to sit down for hours in one of the study rooms, just going through the pen, trying to work out, like, can I apply for this? Can I not apply for this? And so that does take a while, because they do look at your A-level results. Some do, some don't. What certain courses you took at A-level, and then also what is your degree in? Is it a science or non-science degree? So for graduate entry medicine specifically, that can be quite a challenge, because normally the ones that want only science students, you can do the UK CAT, whereas the ones that want non-science grads as well, or allow non-science graduates, that tends to be the GAMSAT. And the GAMSAT, obviously, this big exam you take. It's about 5.5 hours or so, and it involves a comprehension test, writing 2 essays, and also a big science test at the end. And then because of that, you then have to go away and look into how do you apply for that, because it's actually run by a company, the exam board, as it were, ASA, which is in Australia. So you have to look online when you can apply to register for that exam. And there's a lot of paperwork sadly with that. But there's lots of great resources to look into to see how do you do that. And there's a lot of stuff on Instagram. This, for example, is a great platform to get students aware how to do it. So that was the next hurdle, was finding out like which courses offer it, and then the exams. And then the final step is then looking at, like, are there any other requirements? So work experience would be the main one here. Now I know for some places on the graduate course they're very specific. So Warwick, one of the previous people you spoke to, Warwick is very specific. They want 50 hours or 70 hours, and it has to be in a certain period of time, and it has to be in a certain area of shadowing, or it has to be a certain kind of experience. It can't just say be tutoring. It would have to be in a hospital.
Yeah.
So at St George's, I don't think it's as specific, but again, they, as a graduate, they expect you to have some experience, because the first thing they're going to ask you is, why now? Why are you here now? And you have to be able to, supplement that with, these experiences of why I'm now, wanting to pursue this career. So all in all, it is quite a difficult application process. But once you kind of get aware of how it all works and the acronyms they will use and the abbreviations, it does start to make sense. And slowly, after a couple of weeks, you kind of feel prepared on how to apply. And the only other thing I will say as well is, when you apply, you are applying, unlike at school, when you apply for your school, you actually are applying as an individual candidate. So the UCAS application itself is down to you. So that's quite daunting, because when you get a reference, you have to actually find the person and make them aware that you're going to send the link over to them for them to fill in. I was very lucky that my personal tutor at Bristol, he did that all in such great time for me. But there have been cases where if it's delayed at all, they will sadly just reject your application. And that's the last thing you want after all this kind of preparing work and hours and hours and weeks, to have it all just gone like that. So yeah, being kind of being aware of the times and the deadlines and things is a real important thing just to consider.
Yeah, absolutely. Because I remember looking at the dates of the exams, and some of them are really early, and a lot of the deadlines are really early. So if you miss one of those, it's kind of a whole year again until you have to apply.
And actually, that's quite a challenge with the GAMSAT in particular, is that the GAMSAT is only held twice a year. It's not like the UK CAT, where you you can take it between kind of so many months in the summer. So that, and the other challenge actually with the GAMSAT is it's also not held in many places. So for the United Kingdom, as it were, there's like a hub in, say, Scotland and Northern Ireland, and then you've got one in London, Cardiff, a couple in the north. And that can be a challenge. So I was quite lucky, because so being in Bristol and my actual home being in Swindon, I wasn't too far away from the Cardiff one. But again, that's something you have to consider, is how are you going to get there? Are you going to drive the night before? Because if you've got a kind of 6-hour exam, or 7 hours when you include lunch and things, that is a long day, and you've got to work out how am I going to get there, and also the price of it all. So sadly, on a kind of going back to a bit earlier about kind of more barriers to medicine, I think the issue with the GAMSAT is it's very expensive. And actually, there's been a lot of talk between people. How can the universities in this country kind of reduce that price in order to get more people to apply? So it's about £250 is what it will cost, and then that's before you buy resources for that, and they can be very expensive. Practice papers can be a couple of £100 when you buy books of them, or there's a standalone book as well, which is a gold book standard. That in itself I think is about £100 just for one book. And so yeah, that's a challenge actually, is being aware of how to actually tackle the exam, but not also using spending so much money on these resources. And that's quite a common story you hear from people, is that if they ever kind of give up on applying to medicine, you ask why. A lot of the time it is because they've taken the exam 3 or 4 times, and it's not been enough to get in, sadly, just for whatever reason, and they can't afford to keep applying. It's a real shame, I think.
Yeah, no, definitely. I think pretty much the only positive of GAMSAT is, from what I've heard, is that your exam score can last for a couple of years, and I think you can take a subsequent exam which will rewrite your exam score, whereas the UK CAT, it's a once a year, that's your score, and you have to redo it the next year. But I think otherwise the GAMSAT is not an appealing thought. No.
Yes, I think it has a shelf life, as it were, 4 exam sittings, so 2 years. And yeah, so then that's quite a challenge actually, is working out whether do you sit the exam and then apply blindly, which is what I did. So I took it in the September period, and then you apply in October, but you don't know your scores. Whereas at least with the UK CAT, you know your score instantly. Or do you take it in, say, April and then September, and then you kind of gauge, right, which one do I want to go for? So yeah, that is a lot of things to think about. I think sadly with the application for medicine, it's a lot more kind of convoluted than, say, any other course that you would apply for university. And then that applies as well. Dentistry and veterinary science is just as challenging. The health sciences collectively have a lot of kind of admin and kind of very niche criteria.
Yeah. So you took the GAMSAT, and did you take the UCAT as well?
Oh yes. So actually that was another part of applying that was a challenge, was trying to work out which courses to apply for. Because I knew realistically I only want to apply for the 4-year courses because of the funding that you get for it. And that instantly whittles down the courses to less than 20 courses. And So that was quite difficult actually, because then you realize actually your kind of choice gets more and more limited. So I thought, well, it's probably best to take 2 exams, because then at least that keeps some of them open. Because for example, with the GAMSAT, I think you've only got 5 or 6 universities you can apply for. Whereas at least if you have the UCAT, it kind of builds that to a few more. So I took both, and actually I feel like when I prepared for them, I actually prepared for them the wrong way around, looking back actually. So I spent my summer after second year sat there trying to revise in the summer for the GAMSAT to take in the September. I spent many hours on that, and I thought that preparation would be really helpful. Whereas with the UK CAT, I actually, or as it was called then, now it's changed to UCAT. I didn't spend much time on it. I think I underestimated it, because I thought, it's just like logical reasoning, as it were, for 5 sections or so. And actually looking back, I wish, if I had to do it again, I wish I'd prioritized that, because that was actually something that I was a downfall, because I didn't do very well in the UK CAT. And I remember when I got my score, it was in the kind of, was it mid 2500s? It was around kind of that region. It would have been maybe all right for undergraduate, but sadly for the graduate criteria, it's a lot higher. You're looking at kind of 26, 7, 8 plus.
It's really high.
Yeah, so that was quite worrying, because I remember taking that, and this was before I'd taken my GAMSAT, and thinking, right, well, I need to do really well on the GAMSAT now, because otherwise there's no choice. And whereas I spent a lot of time revising for the GAMSAT with this one big book, but actually because of how it's done as well, it's very much logical reasoning. It's not, you can't really learn for it. Whereas with the UCAT, I think you have to actually prepare in terms of the timing. And looking back, I wish I'd practiced some timing. And I know online there are some great resources, and I really do wish I'd used that. So that'd be my advice to anybody, is actually think about, what is your timing like for both exams as well, respectively, because they do have quite tough challenges with how many minutes you get. I think it's like about a minute a question you have. But actually the UCAT, I think, is the one not to underestimate, because the GAMSAT kind of is, your questions are kind of there in the moment, but you have a bit more time to think about it. And each section in the GAMSAT is separate, whereas in the UCAT, because it just rolls over to the next section, if you start, if you get yourself in kind of a bit of stress or whatever, you that will kind of build and build and build. So yeah, that was the challenge with those entrance exams. But then, and also now you have the BMAT, and I think actually it wasn't many universities that were using it at the time. I think it was only at Oxford you had to do the BMAT, but now Imperial's brought a course in. So I thought I'd check actually today, because when I was looking at applying, the Imperial course was there, and then it disappeared. They scrapped it. But Imperial has now brought their course back, but it's actually a 5-year course, because the undergrad is a 6-year course, so the graduate is a 5-year course. They have another year, because I think it's to allow the intercalated year. So that's another university you can look at now. So there's 3 essentially entrance exams, and then Cambridge itself doesn't require an entrance exam, which is always interesting. So for the undergraduate it does, but for the graduate entry it doesn't. Yeah, so there's quite a lot of choices, but yeah, definitely the GMC is where I'd start looking for where to apply to, because it has all the information on there, and then the websites respectively of the universities.
Yeah, some really good information there. And when you're saying that it was important for you for it to be a graduate course, like the next stage of that, what else were you looking for in a course? Was location really important? Style of teaching? Like, what were you looking for within a graduate course?
So I'm not sure actually. When I look back, I tried to kind of pinpoint what it was, but because the choices are so few, it's you almost become aware that you don't need to be that, you can't afford to be picky, because there isn't much an option. So I remember, particularly because I was looking at the GAMSAT one, so I applied for the GAMSAT, I applied for Swansea, St George's and Nottingham, and then for the UCAT it was Warwick. And I think the course, in terms of the graduate, as all kind of graduate entry, because of how they have to squeeze the course into 4 years, there doesn't seem to be as much variation as you would expect to say the 5-year course. But I think the one thing that appealed to me mainly with coming to St George's actually was the fact that it's a hospital, and the universities within the hospital. I think that they're the only healthcare specialist university in the country, and that was always appealing, because it was it's quite a unique place to be, that you can walk through the doors and you're seeing patients everywhere. One of the kind of running jokes that we were told in our introduction week was never walk around with a stethoscope around your neck, because patients might approach you to ask you something. So it's quite a funny thing with that. But yeah, and also the anatomy. So every university has their own ways of doing anatomy. Whereas we're very lucky here that ignoring kind of normal COVID times at the moment, but you would be normally you'd go in and you would have full body cadavers, and you can look at them, and you'll have clinicians with you, and you can really look into the details of these anatomical positions and parts. Whereas I know for some people they don't want that; they might want kind of models that you can get, or even digital imaging. So yeah, that was something I was always interesting. But mainly it wasn't really the location. I was quite happy to go anywhere. I thought it'd be quite exciting to go somewhere different, which was interesting actually, because I remember Bristol had a graduate course, but actually they before I was going to apply, they got rid of the graduate course.
Yeah.
I think it wasn't financially viable, I think, for the university to keep it going, which was a shame. So they scrapped it. But then in the same year, they brought in the graduate entry veterinary course. So it's a bit strange, but I do wonder if they had kept it, would I have stayed in Bristol? Because I do, Bristol was a great city to be in. Yeah, like again on that the big document on the medical council offer online, they have all things like that, how anatomy is taught, how placements are taught. You can really look on there to what your own preferences are, and just kind of cross those out that you don't feel would be where you want to go.
Yeah, I think it's a balance of where can you go, and then when that list is narrowed down, between those. So, and how did you find the application process once you got started, kind of like the interviews and and bringing your previous degree experience to those interviews?
So I think it was quite a strange one, because when you actually apply to these universities, they'll send you information about how they do their own assessment. And one thing I thought was quite surprising is how many different ways you can have an interview. And again, that's something I hadn't really considered before thinking about applying. And it's some will use the mini interview stages, the MMIs. Some will do a very kind of it's not really formal, but it's a very formal setting in the sense that it's like a 2-to-1 interview. So for example, at Swansea, it's a great interview. They don't talk to you in a way that's very kind of stressful. It's much more of a conversation, but it's the fact that it's 2 people on 1 person is very formal. I found anyway. Whereas at St George's, it's MMIs, and Nottingham was a similar. It was that you go into different rooms. And actually, on the topic of applying, so my score was too low for Warwick actually when I applied, and I thought at the time actually this was going to be too low, which is why I put 1 UK CAT score, 1 UK CAT university and 3 GAMSAT universities down. So that's another thing I would actually recommend quickly, is try and be, as is difficult obviously, but try and kind of be honest with yourself, is that where should you kind of place your bets in terms of getting an interview, because sadly for the graduate entry program, they don't look at your personal statement until the interview, and some don't look at it at all. And there are issues with that naturally, but it's a shame how it happens. You just have to be careful that you have to meet certain cutoff scores. So for example, for those that take the GAMSAT, it's generally considered that any score above 60 is safe in this country. It's very different to Australia, so you have to be careful when you're looking online, because Australian scores are much higher because more people take it. So because so few people take it in this country, kind of above 60 is safe, whereas I know with the UK CAT, those scores vary massively every year. So that's always something to be careful of. And actually, if you're ever looking at applying to, they call it the Scots Gem, which is up in between like St Andrews and Dundee and those sorts of universities, you have to have both the UK CAT and the GAMSAT. You have to have the GAMSAT as a whole, but you have to have the session at the end. I forget the name of it now. When you do the judgment of situational judgment,
okay,
that you have to have that score. So I don't think you have to do the whole exam, but you have to have the situational judgment part. And they'll say they expect like a 1 or 2 in that score. So again, it's just more stuff to be aware of, where you're applying. Sadly, it's trying to place your bets, because it's like for any application, both undergraduate too, I guess, it's only 4 choices out of 5. And so many people are applying that you kind of have to, that has to be your main focus rather than anything else actually. So that was quite a challenge actually. And then the interviews, look kind of general things that you're aware of, why medicine, why here, and also about yourself really, what brought you to this path now. And like I said earlier, with the graduate course in particular, they want to know what's made you go from, say, your undergraduate degree in whatever field that's in, to now pursuing medicine. And for me, I spoke a lot about my role as a dementia volunteer, the patient befriender role, and also as a carer. And it's one of those cases where you don't have to worry about preparing for it if you did the experience, because it will come across in that naturally. It won't come across disingenuous. Whereas I think some people, some of the recordings you've had before with people, they've talked about you don't want to over prepare, and it's so true, because if people know that your answers aren't legitimate, it makes them wonder, are you suited for this course, and would you make a fit with patients in our ethos at this university?
I think there's a lot to say for just developing your ideas on situations around medicine, so putting yourself in those environments, doing the experience, discussing issues in medicine, and just developing what your ideas are on that, and what are your thoughts, where do you stand on different issues, and then being comfortable just talking about those for the interview rather than trying to script specific answers. But there's always the good at preparation in, why do you want to, what challenges, kind of, I think it's a balance of preparing, but in quite a non-specific way.
Yeah, definitely. And I think actually one thing that I wasn't really aware of until kind of last minute was it's okay to be critical of being a doctor. What, there are cons to being a doctor, and I think
Absolutely.
a lot of people are worried about bringing those up because they're worried they're going to be portrayed as, oh, they don't want to be here. But actually, in one of my interviews I had one of my stations, it was a fantastic interview talking about kind of the challenges, and ultimately you need to have resilience, and that isn't a negative to say, because again, that just shows that you're aware of what this is going to lead to in later life. I think actually, being older, being a mature student, irrespective of the 5-year course or the 4-year course or whatever, you bring so much life experience and awareness of the challenges surrounding medicine and those pertaining to being a doctor. And I think that does shine quite well actually in interviews, because it's the fact they're aware as well that the challenges, it really does help build that kind of confidence in the application.
Yeah, I think it's kind of, I suppose, one of the worst things you could do is just show a complete blanket rose colored glasses towards any career or any application, because it shows that you don't fully appreciate what the challenges are and what the potential negatives are. I think appreciating that there is potentially understaffing or under resourcing, and actually is really long hours, and actually you might get emotionally really pushed. I think if you ignore those, it shows a real misunderstanding of what job you're going into. I think
as well, and also the dynamic of a doctor. I think a lot of people have this misconception that this very kind of doctor goes into a room and that they're in charge of everybody and everything, and that's not how care is delivered. And again, you realize that the challenges of a doctor show that you need to have your teammate and your colleagues, and actually when you start the course, you're given lectures formally on teamwork, and actually how it's a dynamic system between all healthcare professionals. And the reason for that is to try and reduce medical errors, burnout from work stress, and that kind of emotional support with all colleagues. And that's something that if you can talk about those kind of topics through your work experience at an interview, it's something that really will shine through that you are aware of all this. And at the end of the day, it's fine to say that about these challenges, but ultimately you are saying that you've gone home from a shift or whatever, and you've really made a difference, and actually that's why people stay. That's one of the main reasons we still have this this fantastic healthcare service. Even though it's the challenge we have every year get worse, we still have colleagues that are staying and working because the purpose of the job is so great that you feel like you really are helping others.
Yeah, absolutely. I think those conversations do come up more specifically in grad. So I had one undergrad and one grad interview, and in undergrad it's more, I suppose, general, and you're able to pull experiences from different areas of your life, so it doesn't have to be medical experience specific. You can draw it, I suppose, from extracurriculars, from educations, from academics, whereas I was acutely aware during my grad interview that I didn't have caring experience and that I didn't have those same experiences to share. So I think if I didn't get in that year and I had to reapply, I would have absolutely gone for a caring role, so that I could join in those discussions and put a viewpoint across. And I've subsequently done HCA shifts, and I think it would have been such a good thing to do beforehand. The experience is huge.
I think that's something that really resonated with my working as a carer back home. And a lot of the time, you're working on your own, and although you're only with one patient, say an hour, is that hour it really does become kind of stretched, and that everything you're trying to do, and the challenges, every kind of act as a challenge of your client you're trying to help. And I think care experience is really eye-opening, because it makes you realize what medicine is. It's not just a science, it's not just a humanity, it's a combination of both. And the emotional turmoil it can take. So if you I had a few times where some of my patients were in palliative care, and you would naturally you wouldn't be with them for the whole year, so things would happen, or they pass away, and that does take a toll emotionally. But then you look back and you reflect on it, and you realize this is why you're doing this job. This is if you can make those last few months as relaxing and as kind for the person as possible, you can see why you're here. And again, yeah, that kind of experience really does help, I think, in the grand scheme of becoming a doctor. And I'd say in my course, so we have a huge age range here at St George's of other students, and actually, I think most of us, I say while the majority of us are still kind of in our 20s, those that are kind of in their 30s or even 40s, it's great because they've had children or they've worked in completely different careers and respectfully just as challenging careers, in finance and law, and they come into this profession, and although they may not have a science background or that medical experience, those skills are so strong that they really do shine in our when we have our placements or our communication sessions. Again, it kind of you show how holistic medicine is, that you've got all these skills that need to come together ultimately to help the patient.
Yeah. So moving on to now your degree at St George's. So just as you were saying, it's a grad course. You've got people from all different experiences, different backgrounds. Do you feel like that is utilized in the course and that you're learning from them, and that they get to show through their experience?
Yeah, I think it really does, actually. And it's a shame that so many universities will have criteria where it can only be a science graduate, because the ones I've met at St George's, they've been brilliant with the science, and actually having a fresh start when it comes to learning the clinical science, I would say is actually better, because you don't get confused or muddled up with previous scientific knowledge and make things more complicated than they need to be. You can really focus. And so yeah, here at St George's, it's the first year is as a graduate, the graduate course on our side, and then we merge with the undergraduates in our second year, their third year. And even then, when you talk to those in the years above, a lot of the undergraduates seem to enjoy having the graduates there in many senses, because they provide these skills that they're not necessarily being exposed to yet. So I think that works really well, and it does come through in all of our sessions that everyone's got something to bring. I think that's something not to forget, particularly when applying. Everyone has self-doubt about themselves, thinking you're not good enough, but actually, if you can meet the criteria for the entrance requirements or the actual admissions test, you are good enough to be here, and everyone has a skill to bring. I think it's really important to remember that when you're reflecting on yourself.
Yeah, absolutely. And I think I've seen that from some of the mature students coming in the course. They don't necessarily have the same academic background, but oh god, are they so good at talking to people, and the communication skills, and I think it's valuing different people's strengths, and I suppose also not being threatened by them, not feeling like, because it is a competitive environment, everyone's had to work so hard to get in. It's having that confidence that you have your strengths and everyone else does, and I suppose trying to learn from them all rather than worrying that you're not as good at that bit. And
I know that is one thing I know that has been a problem sometimes in the later years when you merge, that sometimes the undergraduates still feel like their voices are kind of dampened down by the graduates talking too much. But again, that's something that everyone needs to be aware of, to allow the floor to be shared and communicate with each other as well as the patient, because it's a key aspect of medicine, is the teamwork. But no, actually, it's quite strange for us, because I think we're one of the very few years which doesn't have someone that's got a PhD or children. So normally every year the graduate courses have had those sorts of people. Again, having children in itself, that so many experiences are brought to that. That probably is one of the biggest definitions of caring for somebody, is having children. But again, even though we don't have that in our first year, we have people from from the finance industry, from law industry, and when you hear them present the cases that we talk about each week, the skills do shine through, and you think, wow, they're so experienced. It's amazing, and you can learn from them, and they learn things from you. It's a great bouncing off each other. It's really good, actually. It's a really nice dynamic.
And your course is set up to facilitate that with the style of teaching. So it's PBL that you use?
So for the 4-year course, the first 2 years are PBL based, whereas for the 5-year course, it's the 3rd year which is PBL based, and PBL being problem-based learning.
Perfect.
So every week essentially we still have a clinical case, and these cases are kind of put into blocks. So for example, one of our blocks was called life support, and life support is all about the heart and the lungs. So within those 5 weeks, you'll do cases. You might do a case on a heart attack or on high blood pressure, and what you do essentially is you have a facilitator, and that facilitator will be a member of staff, but not always directly a doctor. A lot of them actually come from other both non-clinical but also other professional backgrounds. So in my first term, I had a pharmacist they were our facilitator, and then this term actually it's been a physiotherapist. And again, they naturally bring other aspects of care to each other, to us, to our group. And there's about 6 or 7 of us per group. And actually, quite sadly, next week, we're switching for the final time. So in the first year, you switch 3 times. You have 3 different groups, and you go through these cases. And then the week itself is based around the case. So that's been a really nice way of learning, actually, because it's so different to an undergraduate degree. You know, biochemistry was very traditional in the sense that you had lectures with hundreds of people in a room, and then you had labs. Whereas here, you're, you know, in that week. So if you have a heart-related case, for example, in that week, you might go and do the cardiovascular exam in the hospital. You might be on a GP placement, which will do that as well. You're looking at a patient with, say, high blood pressure. And then by the end of the week, you'll do the anatomy as well. And it's a really lovely arching kind of perspective of the kind of patient care, because you tackle all these bits of medicine and bring them together. And we have a thing called learning objectives. We call them LOBs. So you meet twice a week with these groups, and you create your own LOBs. And then on the Monday of the next week, you get given the official list. And actually, we use the official list to learn for the exams. So that's been quite nice, because you can go, you're allowed to, they kind of encourage you to go down rabbit holes and explore topics within your groups. But then on the closing day of the case, the next Monday, you get the kind of succinct kind of what you need to know in terms of clinical relevance to be a doctor and for the exams. So yeah, I think it's a very nice way of doing it, because I know, you know, there's so many different ways to teach medicine that people have preferences on one or the other.
Absolutely. So so in your first year you're with just grads, but then in the second year, is it correct that your PBL groups will be a mix of grads and non-grads? Oh, that's interesting. So it's really integrated.
Yes, it's quite a strange. So because these year groups all become quite muddled, so for my course specifically, our year group is year 1, T year, which stands for transition, and that's the transition from kind of basic clinical science into the purely clinical. You have P year, which is penultimate, and then F year for final year. And they in the kind of the last 3 years, they use that numbering system to kind of equalize and standardize all the other groups. So yeah, so when the undergraduate groups join their 3rd year, they become a T year group as well. And actually, at St George's, they do allow students that perform, you know, exceptionally in the biomedical science degree to be converted over into medicine. So again, that's another group. That's essentially, it's 3 cohorts merging into one. And it is nice that they do tell us that they do try to keep some of the graduates together in the PBL sessions, but ultimately they want to bring everyone together and, you know, utilize all their skills. So in our second year, I think it's half PBL and it's half placements, and then in the 3rd and the 4th years, it's just completely placements, with the 4th year's emphasis being on the fact that you're about to graduate and become a doctor and into the foundation world.
Yeah, absolutely. And it's quite a small, generally, like, year group, is that right?
Yeah. So I think previously the actual amount of students that can enter the graduate course does vary quite a lot. So I don't think St George's has a specific amount that join every year. But yeah, we're about 60 or 70 of us in our year, and then when we join in the 3rd year, I think that goes to about 300 or so. But actually, the university as a whole is only, the undergraduate population of the university is only about 4,000 students, which is a complete contrast to being at Bristol, which is, you know, a very large university, and especially when you consider UE as well next door, an even bigger university. And that environment actually is very different to what it is here. And again, the fact that it's all enclosed within a hospital.
Yeah, so you could realistically meet everyone on your course as a grad.
Yes. So actually, that was actually quite a lovely thing in August when we started. So that's the other thing I should have mentioned, is that the graduate course starts earlier, and the holidays are a lot shorter. And that's to allow you to then cover the 2 years in one, plus and then as you go through the years, the courses, the gaps get shorter and shorter as well. But in August, when you were allowed to meet still outside the lockdown measures, we actually met in the pub a couple of times and in the SU bar. It's quite strange because the hostel has a bar on the 4th floor, and it's always quite a weird experience because people are drinking, getting drunk, and then having to sneak out quite, you know, civilized. But yeah, that was really nice. And then naturally, because you rotate 3 times in your groups, you do populate the rest of the year group. So for example, you have your 3 PBL groups, you have a communication skills group, and then you have a clinical skills group. So that's 5 groups of people, and they naturally try and make each group different. So that's been really lovely, actually, you know, meeting your fellow students, because again, these are likely to become your colleagues in 4 years' times as junior doctors.
Absolutely, yeah. And how have you found, you know, doing the first year, which is notoriously difficult for grad med with just the volume of information? How has that been?
Yeah, so that was always something that's very daunting, actually, starting, because it's one thing you're warned about, and it's quite interesting here at St George's, because so what they do is in the first block that you do is a small 3-week block, and it's called Foundations to Clinical Medicine. So to try and get everybody on the kind of the core principles, you spend 3 weeks doing cases that are very kind of generalized, but they'll teach core principles. So things about blood, about breathing, about the heart, and once you cover that as a kind of a whole in those 3 weeks, that kind of settles you in to be ready for each block specifically. The caseload is a lot, sadly. You have 7 blocks altogether, which covers various body systems, but you finish one case and then you move on to the next one, and that's kind of, you kind of tuck it away at the back of your mind, and then you just, it's up to you in your own time to study that. I think working with others has been really helpful in the PBL. I think that's what the PBL group, that's one of the real strengths of it, is actually that facilitates that kind of sharing the knowledge between you, because you can bounce off each other, and then being able to kind of summarize it on the Monday with the official list of objectives. You kind of feel confident that you know what you need to know for the exam. That doesn't obviously change the fact there's a lot to learn, but it's just nice knowing that you can kind of summarize it and then be prepared to learn it for when you need to. But it is quite a lot, and we do quite a lot of hours a week. So we have 6 hours of the PBL a week, and then you've got 2 or 3 hours of clinical skills a week, which we're very fortunate that it's still in person. I think we're probably one of the very few universities still going in. Throughout the whole of the pandemic, we were going in. And then you have various lectures that will accommodate the learning. So it's quite a lot. But you do have time at Christmas to have a little breather, and then a week off for Easter. So there are some nice breaks, but it's a shame that because of COVID right now, it almost feels like, well, look, we're working all the time. I don't know if you feel that as well. It's just kind of, medicine has become the bubble, which it should be, but it also shouldn't be everything. But naturally, it has become the only focus of work. But again, I think just having to be organised and just make sure you're on top of the work. So the way they set out the exams and the curriculum, it's very much that as long as you're being consistent, they're confident that you will pass those exams, because it's just a case of weekly learning. And actually, I think it's also done in a way that you purposely don't get a study leave. Whereas I know in undergraduates you get Christmas or Easter to revise the exams. I think that's done in a way to prepare you for the later years, where when you're on placement, there is obviously not going to be a study. You're going to go from a 1 day of a placement straight to an exam. So I would describe the curriculum, I think, as tough love, essentially.
Okay. Preparing you for,
and that reflects onto actually being a doctor, where you will be taking your kind of membership to these colleges. They'll be done in your spare time too. So it does really set you up kind of for the long run, even if it's hard to see now.
And I think that's just reflective of generally, undergrad, you've got people coming from school. They do need that transition period to adjust to university life, university studying. And I think personally, what I've liked from being on an undergrad course is I've been able to utilize that time to do other projects. So it's a different use of the time. But actually, COVID has meant that our final year exam now is just we've got no break between the last block and the exam. So that would be interesting. And like you said, it does feel like but when am I going to consolidate? When am I going to? But like you said, it's more like real life. You're going to have to take exams throughout your career. So
but I think that's a strength as well, actually. I think for all kind of graduate students, is that we've learned how to study and how to study well. Actually,
mostly
because I think that's one of the other key benefits, is that people that want to study every aspect of medicine, sadly that's impossible. That's why doctors are specialized as they are. And actually, I think as when you've had a degree and you've done those skills, you've learned those skills before, it does help you kind of cut down what's the key parts to learn and what are kind of stuff you can learn if you have time. I mean, that's been that's a real skill that's useful for when graduates and undergraduates merge in whatever course, because it's it allows you to show others, don't worry about having to learn anything. It's I think we call them high level learning. I think it's called, where it's just taking the key points and that's what you're trying to remember. And
like high yield.
And using those, and there's lots of resources out there which utilize that kind of high yield learning. And I think that's one benefit of medicine, actually, is that the resources are available. So there's always places to turn to if you need to summarize and condense medical concepts.
I think that it is a difficult aspect when there is so much to learn. And when you're interested in it, you do get in these little wormholes of, well, what's the, biochemical basis of this then? And, you can get very lost looking into things in depth, and you kind of have to take a step back and think, this is interesting, but is this for right now? Maybe at a future date.
And that's great, actually, with our PBL cases. You'll have, have a good split of non-scientists and scientists, and actually when you come together to present, it really does show what you need to know because of what everyone else has looked into. So naturally, you'll go into more depth than others, but actually when you come together and you've reflected on the PBL, the patient of that PBL week, you realize actually what you need to learn. It helps you kind of keep focused.
Yeah. I definitely in CBL got put in my place a little bit with biochemistry about everyone else's tolerance of how much biochemistry they will be willing to be shown. So it does, keep you in check that, it's maybe not so relevant.
We had that actually with one case quickly. We there's a breast cancer week, and actually there's all these amazing genes and discoveries that have happened, and you want to go into so much detail, and actually you realize you don't need to go. It's more kind of the screening aspect and then the drug aspect, but you don't need to go into all this depth. Which it took me a while to get used to being a biochemist undergrad, because the small details I loved, but actually I've realized it's more surface level now, and breadth is more important. It's a challenge.
For now. So thinking a little bit into the kind of future, what is there a speciality that you would like to get more stuck into, get into more depth, or?
So I think that quite resonates from our last discussion, actually, because before coming, you have ideas and interests of courses. I thought when I came, having a biochemistry degree, maybe endocrinology, because it's such a close comparison. But actually, coming into it, I really enjoyed the GI stuff that we've done, and actually, I think maybe, and when that combines with the kind of surgery operations that we've looked into, maybe general surgery or something, but also things like anesthesia as well, because we did a lot of that in my undergraduate degree, and that would be something that'd be interesting as well. But again, it's just keeping your mind open, because like you said, you do one week and then you think, wow, this is amazing, and you do another week and it's also amazing, and I'm sure that gets worse on placements, because you'll be in entire blocks of weeks of things, and even we're just about to finish our life cycle week, and that's all about kind of from birth to death, and there's some amazing things to do in obs and gynae, and again, that's another area that I didn't even think about before coming, and now it's been so fascinating that who knows. I think the key point is just keeping open-minded, and just taking all the experience. A bit like when you're getting work experience to apply for medicine, just being open-minded, take any experience you can get, and see how it makes you feel.
Yeah, absolutely. And just to finish up with, if you have any top tips, so either if you would give yourself if you started again, or for anyone kind of thinking about medicine, or during medicine, top tips you've learned.
Also, I think so in terms of applying, I think the top tip would be start early. Again, like we said, there's so many criteria you have to fulfill, so really start early and get as much experience as you can. And in terms of actually the actual going on the course, I think not trying to learn everything and anything, because that was something I tried at the start, and it's just not possible. I mean, I have to type my notes now because there's just too much to do. So I think that'd be my tip. You don't have to learn everything, and take any experience you can get, really.
Yeah, perfect. I think that's something that has come up a few times with different people, and I think that's one of the things where a previous degree might almost have encouraged you to go into more depth. So it's reminding yourself that actually it's the high yield stuff is the most important, and then
and how valued others are as well, how valuable teamwork really is when it comes to learning. That's something I've really learned, actually, because you don't do much teamwork actually in your undergraduate degree. It's not really that much of a focus. You have occasional projects perhaps, but the value of teamwork has really been shown actually starting medicine.
Yeah, absolutely. And hopefully like things like this, people can share in other people's experiences and hear about their different backgrounds, and showcase different skills. Yeah, absolutely. Well, thank you so much for your time to things. It's been really helpful, especially on the application side. We went into a lot of detail about how you found that. So hopefully that's helped some people thinking about medicine.
Well, thank you for having me. And if anyone would like to message me about anything, I'm always, my channel's always open to talk about the process.
Perfect. Okay, so if I put your details below, if you're happy with that, and people can message you. Otherwise, they can also message into the platform, and I can pass those on as well. Perfect. That's fantastic. Thank you very much.
Thank you.
Thank you. Bye-bye.
Bye-bye.